We have caregivers across our system who are taking care of COVID patients. We want to ensure that they have access as well. As we go further into it and have more access to more vaccine, we can then offer it to those who are in primary care and even extend it further beyond.
That was Dr. Kristen Dascombe from Intermountain Healthcare talking about how the vaccine will be distributed over the next few months. Welcome to our third and final In Focus discussion tonight on the COVID-19 vaccine in Utah. Joining us now live in studio is Allie Spangler of the Utah Healthcare Association, the agency that will be working to get the COVID-19 vaccine to long-term care facilities. Allie, thank you so much for joining us tonight and welcome to the show.
Thank you. Glad to be here.
Yeah. Allie, tell us the status of how long-term healthcare facilities are doing right now. We know that there are some outbreaks in different parts of the state, but how would you rate the overall status of all of them?
Yeah, there continues to be COVID-19 outbreaks in long-term care facilities. Throughout the course of the last 9 months of this pandemic, the long-term care staff have worked tirelessly to care for and protect the residents in long-term care. They've dealt with staffing shortages, lack of PPE, outbreaks, increased testing. Like other healthcare workers in Utah and throughout the country, they are tired, but they are hopeful that with the vaccine and widespread adoption of it, it'll bring some relief.
You said that they're tired. I don't know if we can really compare this. Would you say that they're as tired and overworked as like our frontline healthcare workers in hospitals and clinics?
Definitely. Long-term care healthcare workers are frontline workers.
And you have experience being in the shoes of staff at these long-term care facilities. You said you worked for 5 years. So with that personal experience, when you look at these workers, what goes through your head?
Sure. Like I said, they're tired. They've worked so hard. They care for these residents. This is their home. And these residents' lives and the healthcare workers' lives cannot return to normal until this vaccine is widespread throughout the state and the country.
Take us inside, maybe some of these long-term care facilities, especially because family and friends, they haven't been allowed inside for months. What precautions have changed or maybe have been implemented as time has gone on, especially in regards to people being able to see or visit their loved ones in these facilities?
Yeah, at the beginning of the pandemic, long-term care facilities shut down to anyone except for essential care. As the pandemic has gone on, and especially throughout the summer months, on the national and federal level, the federal and the state level, some of these guidelines were able to be eased just a little bit. Facilities were able to get very creative and create plexiglass booths or different mechanisms to be able to have some outdoor visitation. And then recently the Department of Health has released some guidance to allow for indoor visitation as these months have gotten colder and we're not able to do that outdoor visitation.
Does winter or flu season mean anything or impact that maybe?
I mean, sure, definitely. The flu hasn't gone away just because we have COVID-19, so they'll continue to do their infection control policies and procedures and try to safeguard against the flu as well as COVID-19.
So it's been about 9 to 10 months since the start of this pandemic in the country. And today, the COVID-19 vaccine arrived in the state of Utah. Talk about today in a historical context. What does it mean to you and everyone at your agency?
Sure. I mean, it's been a really long 9 months for everybody, but especially the healthcare workers. And to just know that that hope is coming and that there could be some relief for these healthcare workers and for these residents. Like I said earlier, the lives of these residents cannot go back to normal until we have this vaccine in these facilities so that they can have visitors whenever they like and so that they can return to the normal activities of their life. This is their homes that they're living in, and it's been very disrupted because of this pandemic.
I know right now there's still a lot of information that we don't know yet as like the distribution plans are being rolling out. When do you expect to get some of the vaccine for those in our long-term care facilities?
On Friday, just this last Friday, the state activated their long-term care vaccination program. The facilities will be working with Walgreens and CVS to get these vaccines in the facilities as quickly as possible. As of right now, the facilities should anticipate beginning vaccinations in long-term care on December 28th.
Okay, so still maybe a few weeks. Any idea how the vaccine will be distributed? I mean, you touched on it a little bit there. Are they going to be shipped to you guys? Like, how does all that work?
Sure. So there'll be a course of 3 clinics. The majority of long-term care facilities in Utah designated Walgreens or CVS as their vaccination program. So they'll actually be coming to the facilities and setting up these clinics. And like I said, they'll be doing it over the course of 3 different clinics in order to capture all of the residents and staff and then that second dose of the vaccine.
Now, there's still some doubt among some people about whether or not they're going to get a vaccine, right? We don't have 100% of people saying, like, I will get the vaccine. Are you guys requiring full compliance from your clients and employees? And what would happen if someone chooses not to get the vaccine?
Sure, that's a really great question. So it's our understanding that because the FDA authorized it for emergency use, the facilities are actually not able to require it. So it's up to them to work with their staff and work with their residents to really encourage and promote getting this vaccine, and then have their own policies and procedures on how they will handle any staff members and or residents that do not get the vaccine.
Will there be any differences between long-term care facilities in urban versus rural areas?
As in receiving the vaccine?
Yeah, or anything in regards to the distribution plan?
Sure, at this point, no. You know, like I said before, the patients in these facilities are the most vulnerable, and the healthcare workers are working so hard, and we feel that they should all be at the top prioritization to receive that because they are so vulnerable and because the increased and continued outbreaks of COVID in these facilities.
In that case, how do you guys determine which areas or which regions in the state will get the vaccine first? I mean, we know there are some places that are hotspots.
Sure. You know, I'm not aware of that plan at this time. That's something that the Department of Health will have to determine and work with the pharmacies as they distribute those.
Now, we've been hearing from the health department that, you know, even though the vaccine is here, it doesn't mean that we just go back to normal. What have you heard from the health department about maybe maintaining, or what are you guys going to do with safety protocols after the vaccine has been distributed to these individuals at the long-term care facilities?
Yeah, at this point, there's no state or federal guidance on relaxing any of the guidelines that are currently in place. I think only time will tell on how many people actually get the vaccine and the continued efficacy of it.
I want to give you the final word on this. What else would you like our viewers at home to know? Or what's your message to family or friends or maybe individuals staying at long-term care facilities who may be watching this segment tonight?
I would just like to thank all of the long-term care workers. They are amazing. They love these residents. They've been caring for these residents, and they have been working so hard to try to keep them safe and to try to reduce the transmission of COVID-19. So just a huge thank you to you, and just continue your efforts, and we hope that we can have some relief for you soon.
I agree. We appreciate all of our frontline healthcare workers so much. You've been hearing from Allie Spangler with the Utah Healthcare Association. Allie, thank you so much for being with us tonight. We really enjoyed having you.
Thank you.